Kyra Koehler. I'm a senior and I was the Lunt Fellow in Childhood Nutrition and Obesity Prevention, but I was in the Baylor College of Medicine SMART program, which I'll tell you about in Houston, Texas. So the SMART program stands for Summer Medical and Research Training Program. We had 90 students in the program this summer, and it just gives students the opportunity to do medical research. So this is all of us. I'm right here in my Cornell gear, right in front. So that was all of us from this summer alone. As a part of the SMART program, I was stationed in another building related to Baylor. So I was at the Children's Nutritional Research Center, which is run by the United States Department of Agriculture and the Agricultural Research Center in collaboration with the Texas Children's Hospital and Baylor College of Medicine. The focus of the research center is to improve nutrition in children and mothers. And with the rising obesity rates, they're really focusing on preventing childhood obesity right now. I was working under Dr. Debbie Thompson. She's a USDA ARS scientist and nutritionist and an associate professor of pediatrics at Baylor College of Medicine. So I was given like a sheet full of things I was going to do when I got there, but my big projects were a literature review, a text message intervention, and faculty interviews. And this picture is my research team for the summer, who I predominantly worked with. So to start, my literature review, I had to come up with a question that there would be enough literature on, and I struggled with that because I found a lot of things that I wanted to know about that not enough people had looked into. But my question was, how is breakfast consumption in school-aged children related to obesity and overweight? So I defined my search criteria, I found all of my literature, and I found that there's an inverse relationship between breakfast consumption and overweight and obesity. And basically this means the more days that you eat breakfast, the less likely you are to be overweight as a child. So that was one project. My next project, I conducted 15 faculty interviews down there. My mentor has all of her interns do this because she wants you to understand that you don't always go directly into the career that you want to get into. It sometimes takes a little while. So there's a ton of advice up here, but my favorite was just say yes. The man who told me this, his mentor had told him that she would have never gotten to where she was if she would have said no to the things that everyone else said no to. So he said, just say yes and take advantage of all of those opportunities that you're given. And then I developed a text message intervention, and this was probably my biggest project. So it was developed for Hispanic parents to help create a healthy home environment to prevent childhood obesity. And my text messages were based on self-determination theory, which is very complex and I don't understand all of it. But the part that applies to this, there's 3 basic needs that every human should have met to be happy and healthy. Autonomy, so like feeling like you have control, competence, knowing what you're doing, and relatedness and being connected to others. And so I developed text messages to relate to each of these 3 needs to help prevent obesity. And I included reputable links, government websites, stuff like that. And I put an example here, and this is an autonomy text message. Here's 5 easy food swaps to make you healthier. You make the choice. And they hadn't done anything with them the last time I talked to them. They were still waiting on funding, but they would just send like 1 a day to a parent, and hopefully that would kind of help the whole family become more healthy. So I had a ton of other experiences in Houston. At work, I worked on a Butterfly Girls and the Quest for Founders Rock. It was an intervention that my mentor had done before, so I helped with storyboarding for that. I created some data tables for a child executive function project. I interviewed all of the members of my research team. I was able to go out to colleges in Texas and help collect data with other researchers. I shadowed a psychiatrist and a pediatric oncologist and a child life specialist. They had a ton of opportunities set up for us. I helped to run a brown adipose tissue study. And then as a part of the SMART program, we had daily seminars from people at Baylor College of Medicine, just telling us what they were doing. We also had evening activities, so I learned a lot about like the discovery of the helix in DNA. We did a lot with HIV and AIDS. People came in and talked to us about that. And then I was able to be a part of a free GRE prep program. And if you know anything about how expensive those are, that was really great. And I like to say that it helped me with that. And then I also had the opportunity to make some friends. We went down to the beach in Galveston a couple times and just kind of explored Houston, so that was great. So to start, this picture is me and Bob Reimers. He's actually a Cornell alum, and he helped to set up the fellowship like 10 years ago, I want to say. His wife actually works at the building that I was at, and they're the ones who made the connection. So it was really great to actually get to meet him. But there were a ton of impacts this summer. The biggest one, my career goals shifted while I was in Texas. I went down there wanting to be a speech pathologist, and mostly through my faculty interviews and my shadowing, I'm now going into child life. Basically, you work with children in a children's hospital and their parents to help normalize the experience and make it a little less scary. Personally, I'm much more confident, and Sarah mentioned independence. Mount Vernon's the biggest town I've ever lived in, so being in Houston, that was pretty scary. But a lot of independence and confidence gained from that. And there were a lot of lessons learned and reinforced, like just say yes and take advantage of opportunities you're given. And then academically, my literature review was really helpful to go through that process. I actually just got out of my senior seminar for my psychology degree, and I was able to use the basis of my literature review from Texas and build off of it and go a little bit further with it. And then just having the research experience was amazing, especially going into grad school. So I want to thank the Cornell Fellows Program and all of the donors that made it possible. My site supervisor, Dr. Debbie Thompson, my faculty sponsor, Dr. Melinda Green, and then all of the people with the SMART program, Dr. Gail Slaughter, Carrie Mejia, and Lakeisha Batts. Thank you.